Nurse manager, I'm a bit nervous about handling babies for vaccinations. I'm not sure if I'm doing it correctly.
That's understandable, Mihira. Handling babies can be challenging, but with practice, you'll become more comfortable.
What are some tips for handling babies safely and effectively?
First, it's important to wash your hands thoroughly before and after handling a baby. This helps prevent the spread of germs. Second, always support the baby's head and neck, especially when lifting or holding them.
I'll be sure to do that. What about the vaccination itself? How should I hold the baby during the injection?
It's best to hold the baby securely on your lap, facing away from you. This allows you to control their movement and minimize discomfort.
I'll practice that technique with some of the baby dolls in our training room. Do you have any other tips for handling babies during vaccinations?
Remember to be gentle and reassuring, Mihira. Talk to the baby in a soft voice and offer comfort. If the baby starts to cry, try distracting them with a toy or a pacifier. It sounds like you have some questions about getting your influenza vaccine, MIHIRA, and that's perfectly normal. I'm here to walk you through everything so you know exactly what to expect. Getting your flu vaccine is typically a quick and straightforward process, often done during a single visit appointment. When you come in, we'll first do a quick pre-vaccination check, which includes ensuring you're feeling well and don't have a fever. Since you have diabetes, we'll also perform a pre-blood sugar check to ensure your levels are stable before the vaccine is administered. This is a standard safety measure for you. After the vaccine, we'll also do a post-blood sugar check to monitor for any immediate impact, though it's usually minimal. The vaccine itself is given as an injection, most commonly in your upper arm. It's a very fast process, and we'll be right there with you every step of the way to make sure you're comfortable. It's completely normal to experience a few mild side effects after getting your flu shot, and these are usually a sign that your body is building protection. The most common ones are usually just some soreness, redness, or a little swelling where you got the shot. You might also feel a bit tired, have a low-grade fever, or experience mild aches, similar to a very mild cold. MIHIRA, for managing these, over-the-counter medications like paracetamol can be very helpful to ease any discomfort. Applying a cool, damp cloth to the injection site can also provide relief for soreness. Most of these symptoms are mild and typically resolve on their own within a day or two. While it's rare, if your symptoms worsen significantly, or if you develop a high fever, severe pain, or have any difficulty breathing, please don't hesitate to contact your doctor immediately. We're always here to help and want to ensure you feel well and safe after your vaccination.